Let me run my periscope. Hey, Emily. Hey, Emily.
Look, Emily.
Hi, show everyone your cherry eyes. She's smelling something.
Emily, look.
Hi,
Emily,
monkey.
sit, Emily.
Look how good her cherry eye swelling's gone way
Look,
down.
honey. Look.
And we're here. We're going to see the orthopedic surgeon today to look at your knees because you have bad knees.
Good girl.
And look who came by for moral support. Puppy Monkey Riley, who's not a puppy anymore. He's all grows up.
He's a big boy.
He's a big grown up.
He's a big boy. He's an adolescent.
He's an adolescent. I didn't even recognize him.
Look, honey.
Puppy Monkey Riley.
Good boy, honey.
Didn't recognize him.
job,
He looks
buddy.
great.
Good job, buddy.
Emily, Emily's being fostered
Look, Emmy.
by Kathy Lopez and Frank Lopez, and
Emmy.
Puppy Monkey Riley is their dog.
And they're BFFs.
They're BFF, so he came to give her emotional support today. Right?
Buddy.
Are you an emotional support doggy? Hi.
Good job, Riley.
Good
job,
boy.
Emily.
Oh my gosh, he's such a big grown-up boy.
Isn't he huge?
Look at you. Oh, there's little Emily.
Here, Emily. Sit.
Yeah,
Hi.
Good
There's
job.
Emily.
Sit. Good job,
Good,
guys.
good job.
Do you want to look over there so everybody can see
Hi.
your pretty face?
Oh, you're getting hearts. People on Periscope, they tap their cell phones to give you hearts. You're getting a lot of hearts right now.
There you go.
Emily, we're going to get your knees checked out, right? Because your regular vet noticed that you have some bad knees. Which one's the worst one, the right one?
Yeah, the right one. Yeah, sometimes when she runs, it looks like it pops, Look, honey. Look. There you go.
Yeah, we're going to have to get her knees evaluated because no one's going to adopt her if she's got bad knees that aren't fixed. So we're going to check it out. We're going to see, we're at the VC West LA Animal Hospital, and the orthopedic surgeon, Dr. Haynes, is going to take a look at Emily.
Oh, I put Cabrera.
Yeah, you know, Dr. Cabrera normally works on Sundays, but she's off today.
Come here. Look, Amy.
We're not sure if it's luxating patella or if it's patella that's just out. There's different ways. There's luxating patella, and then there's luxated patellas.
Yeah, sure. What?
There's different forms of, but it's a knee problem for sure.
Say hi. Come and say hi to everybody.
Emily,
Come and say
look how
hi.
pretty your cherry eyes are all. Oh, hi, Puppy Riley.
Hi, monkey.
Puppy Monkey Riley. He's a puppy monkey. Hi.
Okay.
Puppy monkey. Okay, we'll turn this back on again once we're in with the vet exam, if we can get an internet signal in there.
Here, Mom.
So, oh, there's Maria. Ooh, Puppy Riley. Maria, look at him. He's all grows up. He's a big grown-up boy.
Say hi.
Look at him all grown up like a big boy. Sweetie. All right, we're gonna turn the periscope off. We'll turn it back on once we're in the exam with the vet and Emily. Periscoping because
See, I had a bath yesterday.
Emily, look at your little wiggy wuggy,
Oh, monkey.
wiggy waggy Emily.
Where's your baby?
Yes, Emily.
It's
Yes.
your buddy, right?
Yeah. Oh, and Puppy
Riley.
Monkey Riley, I love you. You came for moral support for your friend Emily.
So good.
He came to support her.
See the
Em,
BFFs.
Hi, Emily. Yes, Emily the Bean. Oh, and she's already getting hearts. Look at that.
Oh, good.
We're just waiting for Dr.
honey.
Haynes to come in.
Oh, honey boo.
Dr. Haynes saw Emily in the back, and he did an exam, and he's going to come in and talk to us.
Say hi. It's the bean.
I wonder if he's going to want to do x-rays today on her knees. I guess we'll find out. Emily.
Look.
Emily, with your bad knees. She's so sweet, though. Look at her little tail wiggy waggy.
It's always
Her
wagging.
little bum. Oh. Oh, I see Linda Snyder. Lots of hearts for Emily and Riley. Puppy Monkey Riley. You're getting hearts right now. Look at that. Look at that. You do not know what the hearts are.
Oh, my baby.
Look, people giving Riley hearts. Oh, Joe is here. Hi, Kathy and Kathy.
Hi, Joe.
Emily the Bean. Emily, the little tiny bean. She's little. What was she? 18 pounds, right?
Yeah.
She's little. And her cherry eye swelling is down. Look how good that is.
Don't want to cause any trauma coming in the door.
Hi.
Dr. Haynes.
I'm Kathy.
Oh, Kathy.
I'm
good to
Kathy
meet
Stanley.
you.
This is my volunteer, Kathy Lopez.
So two Kathys.
So
Kathys. Your name's not Kathy.
No.
Right.
I'm the Kathy that you always talk to.
I recognize
Nice to
your
meet
voice.
you.
Nice to meet you as well.
I'll be seeing you next week with Dixie.
Awesome.
She's
I've
walking
got the
good.
video, and
She's walking great.
And I printed out the paper. It's just been a crazy couple days.
Oh, okay.
So we'll get that filled out for you
Okay.
and emailed back to you as well. But
so,
that's fine.
we have a code yellow. Who made
which
it?
as usual.
Look at that.
I don't
Emily?
know. It might have been Emily.
Oh, okay.
Because
She is adorable. Emily is a
She
cutie.
was
Yeah.
okay. She's a little nervous meeting
She's
strangers.
nervous, yeah, but she's
Okay.
adorable.
So Kathy is fostering her
Okay.
for Camp Conquer Rescue.
Great.
The regular vet that just did Emily's cherry eye surgery 3 weeks ago, he picked up on the knees. She said grade 2, grade 3.
I probably would grade them both a 3.
Both a 3,
And,
okay.
yeah.
And now she doesn't seem to be in any pain or anything,
Mm-mm.
but in terms of getting her adopted, I'm not going to get her adopted if I. So for me, it's like we want to get her adopted, so that's why we're here to see what your evaluation is.
Sure.
and-
So patella luxations, we'll just talk about them in general.
And I'm recording this, and so we might have to fundraise.
Okay.
I'm thinking we're going to have to fundraise.
Yeah.
So people are going to want to hear what you have to say.
Sure. Patella luxations, in general, they are a developmental problem. So she was born with kneecaps that wanted to move towards the inside of her leg. And so we think about this as being a problem of just the knee, but it's actually a problem that originates all the way from the hip down to the ankle. Because the quadriceps that is kind of a part of the patella or the patellar tendon originates from up at the hips, and then your patella kind of goes past your knee onto your tibia. So a lot of the time we do surgery that just addresses the knee, but this is a biomechanical problem from the hip down to the ankle. And so we are fighting her body in order to try to put the kneecap back into the right place. And so when we think about kneecap luxations or patella luxations, we grade them from 1 to 4, 1 being the least severe, 4 being the most severe. And so a grade 1, usually those dogs, you don't know that they have a problem. They look completely normal, and they go into the vet, and the vet is able to push the kneecap out, but it pops right back into place.
Right.
And so it wants to be in the right position. There's just a little bit of laxity to it. A grade 2, again, wants to be in the right position, but can be pushed out and then kind of wants to stay there until it gets pushed back into the right position. A grade 3, those want to live out. They are not usually in the groove that the body has for the patella to ride in. They normally want to be outside of that groove, but a vet is able to push it back into the groove, but the minute they kind of let it go, it wants to pop back out. A grade 4 is where it is out of that groove, and despite my best, pushing as hard as I can't push it back into that groove. The quadriceps has contracted so much on that side that I just cannot push it back into that position. And our kiddo Emily here has what looks to be bilateral grade 3 patella luxations. And so when I watch her walk, she kind of walks with a gait where her knees are out just a little bit, because I think her patellas are naturally riding on the inside of that leg the majority of the time. I think that it's probably not very often that it's actually in the normal groove, and her body has started to adjust to that. And so that's what we end up having to fight against.
So she's learned to just walk with them outside of the groove.
Exactly.
Is it painful?
It's
Uncomfortable?
It's probably what she knows. So I don't know if it's significantly painful. It probably feels weird, but her body has adjusted to it. So the long-term effects of it are arthritis forming in the knee because of that kneecap rubbing in the wrong location. And then it increases their risk of potentially having an ACL tear in the future. Because the patellar tendon is a normal part of the stabilization of the knee joint, that when the patellar tendon is pulled off to the side, that ACL ligament has to undergo more stress than it normally would when the patella is in the right position. And so it increases their risk of potentially having an ACL tear in the future.
Okay, so surgery.
Yes.
All right.
So how do we decide if surgery
Yeah.
is needed? So when we think about surgery, it's very rare that we ever do surgery in a grade 1. Unless the dog comes in and the owners say they notice that he's limping at home, I
Yeah.
don't usually do a surgery in grade 1. Grade 2, if they're non-clinical, meaning that the owners didn't notice that it was a problem, and again, it's wanting to ride in the normal groove the majority of the time, again, I don't always do surgery in those, probably about 50% of the time. Grade 3s and grade 4s, I always recommend surgery in those because they are riding in the wrong location.
And I don't want to risk her tearing an ACL at some point.
Yeah.
Even if she had an adopter. Right now she has no adopter,
Right.
so.
Right. And I mean, by fixing it, it doesn't completely say she'll never tear an ACL. It just
Right.
reduces her risk back down to what it would be for a normal dog.
Okay.
So with it out of place, then it increases her risk of an ACL tear in the
Okay.
future. So,
And now, do you like to do one knee at a time?
I'm usually one of those people just because it's hard to take both legs out on a dog to where they're super sore on both back legs.
The recovery's hard on the dog.
The recovery is harder on the dog. There's a greater risk of complications when you do both back legs at the same time, but it does, reduce the length of time for recovery. So it's one of those things that I talk to the owners when we have bilateral problems
Right.
very carefully about the fact that, and being that the rescue is the owner right now, that it's one of those things that I know you guys are really good about taking them to do rehab and doing
Right.
all of those things, that if we want to try to do it at the same time to give her the shortest amount of recovery, knowing that it's going to be a harder recovery, but it's going to be a shorter recovery, I'm probably okay with that in her. But if we
we've
want to
done
just
that.
stage it, I don't think that's wrong. That's probably
Yeah.
my preference. So.
I mean, we've had a few dogs that had both knees done at the same time,
Mhm.
and it was really hard.
Yeah.
So I would say we'd probably do it one leg at a time. Would you do it 8 weeks apart, like do the first one and then the second one?
Yeah, I
or-
usually say, the earliest I probably would do the other side is around 6 weeks. So, yeah.
We'll probably do one knee at a time.
Yeah, I would think so.
I mean, it just,
It's a lot for a dog to go through.
I know.
So,
I mean, we had
to do
more
both
than
sides, yeah.
Gracie. I don't know, you probably don't remember a dog named Gracie.
Yeah, the Alvin and
Yeah.
Gracie, yeah.
She had a grade 4, like bad.
Bad,
But
yeah.
she ended up having multiple surgeries and then a leg had to be amputated.
Oh.
So it was awful.
I bet, yeah.
It was like,
And that's the time. I mean,
Yeah.
grade 4s are difficult to do
Yeah.
because you are working against the body, wanting to pull that patella off to the side. They're very tough.
Yeah.
They are not things that we go into lightly because they are so tough.
So with a grade 3 after surgery, is there a lot of complications that you would anticipate? I mean,
The
is there
biggest
anything-
complication is the risk of reluxation because again, we are fighting the body's natural pull of that kneecap to the inside, and so it's rare in grade 3s that I have to do. There are some grade 4 NPLs that the body has actually kind of made the leg so abnormal that I actually have to correct kind of what's called an angular limb deformity.
Mhm.
That you have to take x-rays of the femur, the whole femur, to look and see is the distal or the lower part of the femur kind of curved out or curved in an abnormal position to where no matter how many times you pull it back over, because the bone is abnormal, it's not going to stay there, to where you
Right.
actually have to cut the femur and put it into a different position. So occasionally we have to do those on 3s, but on 4s, that's something I really look at because those are
Yeah.
so severe.
So
And-
before you did the surgery on her, you would check that to
Yep,
make sure
we want to
there's
take
no.
X-rays.
Okay.
Yeah, I'd probably still take full femur X-rays just to rule that out. Make sure that again, trying to only do one surgery. The best chance to fix these are usually the first time you go in there. The more times you have to go back and repair,
Yeah,
the higher
it's
the risk
like
of
that's what happened with
complication.
Gracie.
Yeah,
It was like every repeated surgery, it just
yeah. So the highest risk is reluxation. The risk of reluxation goes up as the severity of your MPL or patelloluxation increases. So with a grade 3, you're probably looking at about a 10% reluxation rate. A grade 4, we're looking 20-25% of them reluxate. So, still a chance that it could reluxate, but lower than if it was a grade
Right.
4. Other complications, one of the procedures, one of the parts of the procedures that we perform is actually taking this kind of little bump that you feel on the front of your leg. It's called your tibial tuberosity. In a lot of these dogs, again, it's a growth abnormality. That tuberosity is towards the inside of the leg. So we actually cut it and kind of position it or transpose it over to the outside of the leg a little bit to pull that patella tendon over. And we put pins in there to hold it into position until it heals. And so if those pins ever loosen, then sometimes they'll want to back out and you have to go in and pull the pins once the bone is healed. Once the bone's healed, they don't have to be in there anymore. You could go in and pull them, but we just don't do it unless they cause a problem.
Okay.
So,
okay. All right, so I think we should do one knee at a time, and it's no rush. Basically, I've got Dixie at my house in my little.
yeah, the
It's my
outdoor pen
kitchen.
there. Oh, okay.
It's my kitchen is where all the rehab dogs go. And so I've got to get Dixie finished up and find her an adopter. And when my kitchen is available,
Yeah.
then
This
we
is-
can start
yeah,
on Emily.
This isn't an emergency.
Yeah, it's not an
Okay.
emergency,
Right.
but she's not going to get adopted till we. So I'm thinking maybe we aim for like December if I can get. I gotta get Dixie adopted.
The
Dixie,
video you
who's a
sent me
super
looks-
nice dog.
The video you sent me, she looks like she's doing excellent.
Yeah, she's
So-
she's a really nice dog.
Yeah,
She's
yeah.
house trained.
Oh, wow.
This one's house trained too, by the way.
Yes, yes.
Which is a surprise, and adopters like that. But
Yes, that's a good
So-
selling point.
so maybe if you can you do an estimate
Yep.
for me for each knee so I know like, okay, the first surgery I'm gonna need to raise this much, and then the second surgery in 2 months, or I think I'll probably do them 8 weeks apart,
Yep.
just to get her
That
good
works.
on the first knee, and
You
then
smell my dogs?
just so I know what I need when I'm looking at fundraising.
Yep.
And we'll probably, so as soon as I can get Dixie out of my kitchen, then we'll do her.
Sounds
So
good.
it'll probably be, I'm thinking 2 months from now.
That's fine. I mean, she's good where she's at.
Okay.
Do we need to keep her
Right.
from running now?
I wouldn't. No, they don't
No.
get. I mean, they don't. The biggest risk again with them is it's our increased risk of an ACL. If it tears, it's not a big deal. Besides that she limps, and then we deal with the ACL tear at the same time we do with the MPL surgery. But she's how old? She's pretty young.
We don't really know.
So we don't know, maybe four-ish, yeah.
5-ish.
So I mean, if she was my dog, I wouldn't restrict her. I would let her. Have
Yeah,
a
you can
happy
see
life,
how
but if
she's
gonna-
standing a little funky on it.
Yeah.
Maybe we start with the right leg because that seems to be
The right one, I've noticed when she runs in the backyard, you could see it like kind of pop.
Yep.
So the left one, I don't see that in the left one. It's the right one I think is worse.
Yeah, and that's, I mean, back in when we're watching her walk, that's when she goes out.
Yeah.
So, yeah. But I mean, if it was my dog, she's gonna be restricted for a good 12 weeks. Or,
Yeah.
after all this, so I would let her run and have fun right now.
Yeah,
if she can.
that's true.
So,
Yeah, let her
so,
have fun now,
yeah.
Kathy, until we
do
start
this.
moving
Yeah.
forward on the surgery.
We
So
wouldn't be able to tell if there was any issue
Mm-mm.
this morning.
Yeah.
He started running, she started running after them, and they're just doing laps
Right.
in the backyard.
And most of
it
these
was-
dogs, when we start to get to the grade 3s and grade 4 patelloluxations, meaning either the astute owner that notices that, compared to other dogs,
Right.
their legs stick out a little bit more, may not even notice it because
Yeah.
their body is so adapted to the fact that that patella is riding on the inside of their leg. And that's the hard thing with surgery is that now we're we're working against her body that has wanted to put that on the inside of her leg to put it back into the right position.
Right.
So it's doable. We'll get her there.
Okay.
But it's can be a tough battle sometimes, as you know, with another dog. So.
We've had a lot of knee surgery dogs
Yeah.
for years.
Well, great. I will
All right.
have Alana get you an estimate.
All
You want me
right.
just to have her email it
Yeah,
to you?
that's fine.
Okay.
And then I'll probably see you next week for Dixie's 2-week recheck.
Great.
But she's doing great.
And the video, 3 days after surgery.
I know. I can't believe she was walking
I know.
that good. So yeah, I'll bring her back. I'll schedule it for her in 2 weeks. It'll be probably next Sunday, or
So that'll be
or next
Cabrera
Sunday,
year.
Saturday. No, I'll bring her next Saturday because
Okay.
you work on Saturday.
Well, I do surgeries on Saturday, so it could be Friday.
Okay, I'll bring her Friday.
Okay.
Friday will be 13 days
Yeah,
post
that'll
op.
be fine.
Okay.
Yeah.
And then if I can start taking Dixie to physical therapy to help her now, that would be
Yeah.
whatever I can do to get her ready.
I mean,
to
from
get
what it
adopted.
looks like, she's not going to need a ton of physical.
I know
she's
she's.
doing great. So.
You know, I think it helps too when the dogs are lean.
Oh yeah.
Like she's lean, like Emily's lean.
Yes.
I think it just helps the
Well,
recovery.
I like orthopedics. I like skinny dogs.
Yeah.
Just
so,
like humans, when we
yeah.
carry too much weight, it's hard
Yeah.
on our
I
joints.
know. So I think Emily's gonna be okay too because she's lean.
Yes.
She's little. So all right, Dr. Eanes, thank you. Well, it was
Yeah.
nice to meet you.
Great to finally meet you
And,
too. I know we've talked a lot.
I know.
so.
I know. I live out in Ventura County, so I drive in. But I wanted to see what you
Yep.
had to say about Emily.
She's
So.
a cutie. That's
All
my
right.
Yeah, she
official
is.
diagnosis.
She is.
You got official diagnosis of being cute.